Good day, my people. It's your girl again, Messi Nelson. I'm a physiotherapist and a public health advocate. Today, we are looking at the rising cases of STIs in our communities and the benefits of timely screening and spread control. Many infected individuals stay undetected until it gets advanced and complicated. Hence, the importance of this public health information. As we know, sexually transmitted infections or STDs, they are infections that are commonly spread by sexual activity, especially the anal, oral, and vaginal intercourse. The major STIs include Herpes simplex virus, HIV and AIDS, gonorrhea, syphilis, human papilloma virus, and chlamydia. It is also worthy of note to know that HPV is the commonest STI, primarily presenting as skin warts. Virtually all cervical cancers is caused by HPV. Vaccines are available at different healthcare centers to protect against some of these viral STIs, such as hepatitis A, hepatitis B, and some types of HPV. So, get vaccinated today. HIV testing are confidential and free in many healthcare centers. Don't be scared to know your status. Remember, early detection and diagnosis is necessary in the control of spread and sustaining health. Some STIs can result in decreased ability to get pregnant. Syphilis can remain asymptomatic for over a decade and requires more intense treatment than gonorrhea. Almost every organ can be affected by syphilis, leading to possible hearing loss, blindness, heart disease, neurological syndromes, skin lesions, bone and joint disorders. These issues develop over 10 to 20 years. STI tests may be used for a number of reasons. It can be used as a diagnostic test. It can also be used as a screening test to detect infections in people that are not looking sick but are infected. It can be used as a check for prospective partners to be free of this disease. This should be a tradition for those who understand the scope of this issue. It can also be used as a check prior to or during pregnancy to prevent STIs in newborn. It can be used as a check after birth to check that the baby has not caught an STI from the mother. Stop home delivery today. Go to the hospital so that you and your baby can be properly managed and evaluated to prevent the spread of this donated blood or organs. It can also be used as part of the process for contact tracing from a known infected individual. We all know there are evil folks around today who deliberately spread STIs, especially HIV. Wow, it's one of the wicked, it's one of the worst kind of wickedness. Screening is recommended to help control the spread, ensure early detection, and also for prompt and effective management. It also helps for individuals with multiple sex partners. These individuals are recognized as high-risk individuals and should be tested every 6 to 12 months. It can also be used for individuals who present to the clinic with gonorrhea or other STIs and should be used to tested for HIV. Those with past history of STIs should also be screened for HIV. So if you know you've had gonorrhea before, kindly walk into a hospital for screening today. Screening is recommended in all pregnant persons, including those who present in the labor or at delivery, whose HIV status is unknown. Prison inmates are supposed to be screened regularly, including those that just came out of incarceration. It's also used in the prevention of STIs. Here are some recommendations. Abstinence still remains the best protection from this scourge. Vaccines are available for HPV and some viral hepatitis. Viral hepatitis can ruin your liver. Visit a nearby clinic today to know how you can benefit. Be faithful to your partner, or better still, play safe. Parents must also pay strict attention to their kids and provide behavioral counseling for all sexually active adolescents. Mothers have huge roles to play in protecting their children from these street diseases. Both partners can get tested for STIs before getting into bed or before resuming contact if a partner engaged in contact someone else. Many infections are not detectable immediately after exposure. So, enough time must be allowed between the possible exposure and testing for the test to be accurate. Prevention counseling is highly effective if provided in a non judgmental and empathic manner to persons with different cultures, language, gender, sexual orientation, age, and also developmental level. Prevention counseling for STIs is usually offered to all sexually active adolescents and to all adults who have received a diagnosis that they've had STI in the past year or who also have multiple sexual partners. In other cases, victims of rape should be given post-exposure prophylaxis antiretrovirus regimen and antibiotics as part of routine medical intervention. This prophylaxis is available in most of our health facilities. It is also recommended as an emergency proactive intervention in people who have engaged in unsafe practices. Non-HIV patients with high-risk behavior is recommended to take daily pre-exposure prophylaxis medications to reduce the risk of this infection with the virus. This does not imply you engage in wanton recklessness. In case of exposure to blood from injuries, the exposed area should be immediately cleaned with soap and water. For skin exposures and with antiseptics in cases of puncture wounds. Post-exposure prophylaxis regimen should carefully be selected by a clinician and be given for 28 days in case of exposure to an HIV patient or high-risk individuals. Highly active antiretroviral therapy has dramatically increased life expectancy for patients with AIDS. So there is hope for patients. Just get tested. Available data suggests male circumcision reduce the risk of infections. This shouldn't be an issue in the 21st century, but some people are still non-compliant. Cases of STI are underreported because many of them are not managed in the hospitals. Governments at all levels are not living up to this challenge. So, be responsible to your health. Stop the spread. Stop the diseases. God bless.